Welcome back to Good Day Stateline. Dr. Kapur is back with us today from Transitions Hospice. We're going to talk about how CBD can help hospice patients. Good morning.
Good morning.
Thanks for coming back.
Thank you. I'm happy to be back.
Yes, we learned so much about hospice before, and today we want to learn a little more and specifically. So quickly, if anyone missed your background in hospice, just tell us a little bit.
Yes, so I have been a hospice and palliative care medical doctor for probably about 8 to 10 years now as an attending, and I started off in internal medicine and did a geriatric fellowship, and I'm board certified in internal medicine, and I love what I do.
Which is good. It's very important, and I love hearing that. You obviously love helping people.
Yes.
That's the most important thing. And we've talked about how hospice is about making people comfortable.
Exactly.
And one of the things that's been a hot topic in 2020 has been CBD and marijuana as it became legal in January. So, how is that related to hospice?
Yes, so I just gave a lecture actually last year at Drury Lane in Oak Brook on the differences between medical marijuana and CBD oil. It is a hot topic, and it's something that everybody should know about because there's an opioid crisis right now, which means that many people are overdosing, and primary care doctors are afraid to prescribe now narcotics for patients, so they send patients into a palliative care arena so that it's done judiciously, and especially for chronic pain patients. So CBD oil is made of hemp. Hemp is a different plant than marijuana. Now, the cousin of hemp is medical marijuana plant. And so they have different properties because the hemp has all the cannabinoids, whereas the marijuana plant has the THC component, which is that component that what you would call a person would get high, or there would be maybe some delusions or some effect in the brain. So a lot of people like CBD oil because not only does it work on the serotonin, the dopamine, the endocannabinoid receptors, but it can stimulate a feeling of anti-anxiety, pain, it can help sleep, and it can be utilized at night and in morning. So if we utilize something like CBD prior to or with a narcotic, it can make the patient more wakeful at the end of their life, and the symptoms are the side effects from those narcotics and benzodiazepines that we usually use in end-of-life patients can be less.
Okay.
So medical marijuana, in contrast, can be utilized in cancer patients. There's 28 and even more diagnoses now that we use it for chronic pain to cancer. It can stimulate appetite. It can also help with pain. But you want to be judicious about the form of medical marijuana that you're using.
So, because that's what we talked about last week, or whenever, it feels like last week. You were here last month, maybe?
Yes.
It feels like last week. We talked about just the difference between hospice and just, being in a hospital. And you, like you said, to be more awake and to be enjoying these days with your friends and family, that's very important.
It really is, and that's what quality of life really is in most people's book. Everybody has a different definition of what is quality of life, but most people say, I would rather have pain than be sleepy. So if we can integrate modalities like medical marijuana in the right patients and CBD oil. I mean, CBD is a dietary supplement. It doesn't have THC in it, so the layman can actually utilize it, but judiciously, of course. Medical marijuana, I have utilized it in certain patients, and it has decreased their pain, it has increased their quality of life. And there's different forms of it, so you really want to find maybe a certified doctor or certified center as opposed to just getting it recreationally. You want to have somebody that knows, okay? So there's indica, there's sativa. So the indica makes you more sleepy. The sativa makes you more awake. And then there's hybrids, which they can combine. So they really want to look at what symptoms you're having to give you the right type so that you can use it in different ways, gummies versus, oils and even vapes.
So even though marijuana is now legal and most people would be able to go get it, if it's a medical purpose, you should still stick to going through the correct way.
Right, because what we're finding, actually, after talking to a couple of experts in the field, is that people are now coming more to get the medical card because they're like, what do I get? When they go to the dispensary, which one should I get? I don't want to mess around with this. So it is very important.
Okay, so this is obviously something that you believe to be very, very important and very good to use when it's appropriate with hospice patients.
Yes.
So if anyone wants more information on Transitions Hospice or wants to ask you questions, even though we know you're a busy doctor and a busy mom, where can we go to get some more information about it?
So you can go to our website. It's just been actually updated to transitionshospice.com, and our number will be provided on the website as well.
Awesome. Well, thank you so much for stopping by. We always learn so much when you come in.
You're welcome. It's a
sure
pleasure.
We'll have to have you again soon.
Thank you.
No problem. Coming up next on Good Day Stateline, this is so great. Home Forever Baths is giving away showers to veterans in need, and we're going to tell you how you can help out and how you can get a huge discount on a new shower or bath. And later, we're covering pumpkins with Dory. We'll be right back.